Welcome to this quick guide on precision medicine, targeted therapies.
A targeted therapy works against a molecule that is specific to your cancer cells. In your body, these molecules, or targets, tend to play an important role in helping your cancer cells to survive or spread.
Chemotherapy and targeted therapy work in different ways. Chemotherapy destroys all fast-growing cells regardless of whether the cells are part of your cancer or not. Targeted therapies are like puzzle pieces that fit together with their targets inside your body. This allows the therapy to stop specific molecules that your cancer needs to grow and spread.
Your genes, sometimes called your DNA, are molecules that control how your body makes other molecules, called proteins.
Molecular targets that targeted therapies work against are also called biomarkers. Biomarkers can be genes or proteins. They can also be normal and abnormal cells in your blood. To learn more about biomarkers, see our quick guide on precision medicine biomarker testing.
Your cells, whether they are cancer cells or normal cells, are made up of thousands of genes and proteins.
Targeted therapies are like puzzle pieces that fit together with their targets inside your body. This allows the therapy to stop specific molecules that your cancer needs to grow and spread.
There are different types of targeted therapies. They tend to be either small molecules or monoclonal antibodies.
Small molecule targeted therapies can be taken by swallowing a pill. They act on targets that are inside of cancer cells.
Monoclonal antibody targeted therapies are injected into a vein using an IV. They act on targets on the outside of cancer cells.
There are many ways that targeted therapies work against cancer. These include tagging cancer cells. When monoclonal antibodies stick to the surface of your cancer cells, they act as tags. This makes it easier for your own immune system to find and destroy those cells. A second way that targeted therapies work against cancer is finding and destroying cancer cells directly. Both small molecules and certain types of monoclonal antibodies can stick to targets in or on the surface of your cancer cells and then kill those cancer cells directly. A third way that targeted therapies work against cancer is by cutting off the blood supply that tumors need to survive.
Some targeted therapies stop tumor growth by cutting off the blood supply to the tumor. Blood vessel growth is also called angiogenesis.
A fourth way that targeted therapies work against cancer is by cutting off the hormone supply that some tumors use to grow and survive. For these types of cancers, targeted small molecule therapies can stop tumor growth by stopping your body from making or using the hormones that your tumor needs to survive. A final way that targeted therapies work against cancer is by taking the brakes off the immune system. To keep your immune system from attacking your healthy cells, your body has safeguards in place. These are called checkpoints.
Some cancers are able to control checkpoints. This allows the cancer to avoid being killed by the immune system. Targeted therapies aim to remove these checkpoints. Some targeted therapies take the brakes off your immune system to help your body fight cancer. To learn more about these types of therapies, see our quick guide on immunotherapy.
Even if your tumor has a molecule that matches up with a targeted therapy, it doesn't mean that the therapy will work on your cancer. Or the therapy may work for a while and then stop working. One reason for this is that cancer cells are far more likely to change or mutate than normal cells. This means that the target can change.
Or another reason why targeted therapy may not work is that the cancer has figured out a way to grow without using the molecule that the therapy is blocking.
Sometimes targeted therapies work best when they're given in combination with other targeted therapies or with chemotherapy.
Sometimes, when a patient experiences a side effect from a targeted therapy, it means the therapy is working. For example, lung cancer patients who develop a skin rash while taking therapies that target EGFR are more likely to respond to the treatment than patients who do not develop a skin rash. This is because EGFR is a molecule that is found in large amounts in non-small cell lung cancer cells, but is also found in very small amounts in normal skin cells. That's why a skin rash is a sign that EGFR targeted therapies are hitting their target effectively.
If you're interested in learning more about how targeted therapies can be used to treat your cancer, the first step is to ask your doctor about targeted treatments that might make sense for you.
Let's watch a quick scenario about how a conversation with your doctor about targeted therapy might go. Your job is to help this patient with stomach cancer ask her doctor about using targeted therapies.
Those are my treatment recommendations. Do you have any questions for me?
Are any of the treatments you recommended targeted therapies?
Sometimes patients with stomach cancer respond well to targeted therapies that cut off the blood supply to the tumor, or to therapies that target a protein called HER2.
Is that type of therapy right for me? And do we need to do any tests to find out?
I'm hopeful that the chemotherapy I'm recommending will work. If it turns out that we want to do another treatment, then we can send a sample of your tumor to a lab to be tested for HER2.
Should we do that test now?
Not necessarily. I think we should start with the chemotherapy and see how your cancer responds. If we need to explore additional treatments, we can talk about testing your tumor for HER2. We can also start looking into clinical trials. Sometimes as part of a clinical trial, you can have your tumor biomarkers tested for free. I'll give you some information about clinical trials so you can begin learning about your options.